Mrs. Smith is a G1P1 who had a placental abruption as a result of drug abuse. She lost 800 milliliters during her vaginal delivery and is in postpartum, day 2 after birth, recovering from blood loss and being monitored closely due to elevated blood pressure. Mrs. Smith has been anxious in the hospital and has had trouble with getting her daughter to latch. She is expected to be discharged this afternoon since her blood pressure is now within normal range. The nurse is going to educate the patient and her husband, who is at the bedside, as they prepare for discharge.
Hi Mrs. Smith, I want to sit with you a few minutes to go over a few things related to your discharge. We will want to review your condition, how to take care of yourself at home and be best prepared for care of your baby. Does that sound okay to you? We'll start with your head and work our way down. As you know, you lost a fair amount of blood during delivery. You had what is called a hemorrhage, which is a loss of at least 500 milliliters of blood. If you notice lightheadedness or difficulty speaking or thinking, please contact your provider since these could be signs of additional blood loss. Also, take note if you have any nausea, vomiting or fever, as this could be a sign of infection and you'll want to come back in. Let's talk about your chest next. We've had a little difficulty getting your daughter to latch and I know you've been working with the lactation consultant. She only needs a small amount for each feeding at this point. However, she will start feeding more over the next few days as your milk comes in, so we want to keep an eye on your breasts for mastitis. This is an infection of the breast, occurring on one side, where milk is staying too long in the breast, or bacteria has moved into the milk ducts, causing the breast to be red, hot and tender to the touch. Sometimes this happens with mothers when they get blisters or cracked nipples. Other causes include irregular or missed feedings, failing to allow the infant to empty one breast completely before moving on to the next breast, illness of mother or infant, oversupply, a tight bra, blocked nipple pore or duct, being a first-time mom, and maternal stress and fatigue. Keep us posted if you notice symptoms or feel like she is not getting enough milk. Also, looking at your chest, you want to notify us if your heart is beating fast or breathing is fast without activity. These are other signs of excessive bleeding. As far as your abdomen, you'll want to make sure that you are having regular bowel movements, and if not, you're increasing your fluid intake and maybe taking some laxative. If you have persistent pain or pressure in your abdomen that does not resolve in a day, you should contact your provider. We want to make sure your uterus is not hemorrhaging again, your bowels are active and you are peeing on a regular basis. Moving on to your perineal area. During your delivery, you lost about 800 milliliters that flowed out of your vagina, this size of a very large drink, or about 27 ounces, so it's a lot of blood to lose. A small amount, or about 2 teaspoons, or red blood every few hours is normal and could continue for a few more days. If you notice that you are changing your pads often, such as increased bleeding that is saturating your pads, that is not normal, so you'll want to come in. Also, pay attention to the color. It should change from the red you have now, to a pinkish, brown color from days 3 to 10 and then a creamy white, or light brown color for up to 6 weeks. If you notice that the color is no longer red, then becomes red again, please call us. It is not normal to go back to red color and should progress in this order. Also, if the vaginal discharge or your urine has a foul odor, this could be a sign of an infection. Along with urine, if you have trouble urinating or it burns while urinating, contact us. Some moms get urinary tract infections due to holding urine in too long, after having a catheter at the hospital, not practicing hand hygiene or not getting enough fluids. If it gets bad enough, you will start to have a fever over 100.4 degrees Fahrenheit, so please notify us. Moving down to your legs, since you have been in the hospital for a few days, keep an eye out for deep vein thrombosis, DVT. It's uncommon but can be life-threatening, caused by blood clots forming in the deep veins of the legs. Rarely they can break apart and travel to the lungs, so you will want to inspect your legs daily for the first 6 to 8 weeks, looking for leg swelling, leg pain, warmth, cramping or soreness that often starts in the calf and change in skin color on the leg, such as red or purple. If you notice these symptoms, contact your healthcare provider. If things have progressed and you notice chest pain, difficulty breathing or shortness of breath, facial drooping, arm weakness on one side, or difficulty speaking, then call 911. I know it's a lot of information and you'll probably have more questions. Please refer to the brochures I've provided. They go over the same information I've discussed with you today and who to contact if you notice anything concerning. I will also leave you with this iPad provided by the hospital so you can answer some review questions to make sure you understand everything we've gone over. I will be back to check on you in about an hour.
The nurse is assessing Mrs. Smith, who gave birth to her first child 5 days ago. What findings would the nurse expect? A. Cream-colored discharge. B. Bright red lochia with clots. C. Light pink or brown discharge. Or D. Yellow, mucousy lochia. The correct answer is C. You should have light pink or brown discharge from days 3 to 10 after delivery. Question 2. Which symptoms related to my breast should I notify the provider of? Select all that apply. A. Body aches, chills and flu-like symptoms. B. Pain and swelling of one breast. C. A fullness in both breasts. D. Milk dripping from the breast. E. Burning sensation while breastfeeding. The correct answers are A, B, and E. Flu-like symptoms, pain of one breast and a burning sensation while breastfeeding are all symptoms of mastitis. Mrs. Summers is 28 years old with a history of depression and just had her first set of children, twins. She has chronic hypertension, type 2 diabetes, and a BMI of 35. A C-section was performed and has now recovered from the birth and is ready for discharge. Her husband is at the bedside with her.
Hello, nurse. I am ready to go home now. When can I leave?
Before we discharge you, there are a couple educational guidelines we need to discuss that are important to your health.
Okay, should I be worried?
No, not at all. These guidelines will help support you in this new transition in your life, and what we will be discussing are conditions you should be alert and aware of. There's going to be a bit of information to gather, but don't worry. I have this pamphlet that will be sent home with you that will cover the information we go over today.
Okay, I'm ready.
Now the first thing I want to discuss with you is about postpartum depression. This is depression that can follow after childbirth. Symptoms are severe and will get worse over time. Treatment is most likely necessary due to changes in mood and behavior not going away on their own. From your medical record, you're at higher risk due to your history of depression, and your family members having a history of depression.
What signs and symptoms should I be aware of? And is there any way to help prevent this?
That's a great question. You and your husband should be aware of signs and symptoms such as short bursts of intense crying, anxiety, mood fluctuations, sleep disturbances, a loss of appetite, thoughts of unreasonable worrying about the children's health, suicidal thoughts, and/or thoughts of hurting your children. Also be aware that your husband may experience these symptoms as well. If you think you might have postpartum depression or you have any of the signs and symptoms I have just listed, then tell your doctor. However, there are prevention methods that can help. Make sure you get plenty of rest. Sleep when the babies are sleeping. Make time to go out as having children can be stressful. Try not to make any big life changes that can put more stress on both of your lives. And lastly, talk about your feelings with each other and ask for help and support when you need it. There are support groups out there that you can join with people who are in similar situations.
Thank you. We will definitely be aware of that.
Lastly, we need to discuss postpartum preeclampsia.
Yes, I vaguely remember hearing about this and the possibility of developing preeclampsia during pregnancy, but I thought that if I developed it, it would be gone after pregnancy. What is it again?
Preeclampsia is when your blood pressure exceeds 140/90 and you have protein in your urine and/or organ dysfunction, which then can result in more severe symptoms. You're right though, there was a risk of developing preeclampsia during pregnancy, and preeclampsia usually goes away when the baby is born. However, there is a rare but possible chance to develop preeclampsia postpartum. You're at a higher risk than most people due to your chronic hypertension, type 2 diabetes, your weight, and having had twins.
Wow. I did not know that. What else should I know about it?
You should be aware of the signs and symptoms. They include blood pressure 140/90 or greater, protein in the urine which may show as bubbly or foamy urine, severe headaches, changes in vision, pain in your upper belly, nausea and vomiting, shortness of breath, and decreased urination. You should call your doctor if you exhibit any of these signs and symptoms. To help manage and prevent this high blood pressure, lifestyle changes should be implemented. For example, increasing physical activity, losing weight, smoking cessation, and having a healthy diet. And that's it. Do you have any more questions?
No. Thank you so much.
Mrs. Summers looked concerned when the information was being explained, but in the end, was thankful for her nurse. To make sure Mrs. Summers retained some of the information, the nurse asked if she could repeat a brief description of each condition, a few signs and symptoms to look out for each, and a few preventable measures for each condition. Mrs. Summers was successful in meeting the nurse's expectations. She was then handed an iPad to answer a couple more questions to further assess her understanding. Question 1. Define postpartum depression. Is it a condition that is characterized by having multiple identities? It may feel like you have multiple people living inside your head, and you may feel possessed by one of the identities. A mild form of depression with rapid cycling of mood swings during the first postpartum week. Requires no formal treatment other than reassurance and validation. A form of clinical depression that affects women after childbirth, and sometimes men. Feelings can become worse over time, and changes in mood and behavior do not go away on their own. Can persist for a minimum of 6 months. An emotional disorder that can occur at any time during the first year. It's an emergency psychiatric condition that includes delusional beliefs, hallucinations, and extreme disorganization. The correct answer is C. Postpartum depression is a form of clinical depression that affects women after childbirth, and sometimes men. Feelings can become worse over time, and changes in mood and behavior do not go away on their own, and can persist for a minimum of 6 months. Question 2. What are signs and symptoms of postpartum preeclampsia? Select all that apply. Nausea and vomiting. Blood pressure of 130/85. Severe headaches. Blood in the urine. Changes in vision. The correct answers are A, C, and E. Blood pressure exceeding 140/90 and protein in the urine are other indicators of preeclampsia. Thank you for watching.